I'm Von Biggs, and let's queer up health. Vanderbilt ends adult gender-affirming surgeries, citing operational limits and coverage gaps. Vanderbilt University Medical Center will cease providing gender-affirming surgeries for adults after years of offering the care. Following days of speculation, patients received messages on Friday through VUMC's health portal confirming the change. Previously scheduled surgeries will proceed, but no new surgeries or consultations are being scheduled. Information shared with Nashville Scene also indicates the departure of at least one plastic surgeon associated with the procedures. VUMC, legally separated from Vanderbilt University since 2016, suspended gender-affirming surgeries for minors in 2022 after a state ban. In 2023, the health system provided a list of transgender patients' records to Tennessee Attorney General Jonathan Skrmetti. Last year, VUMC reduced its specialized LGBTQ health clinic. In a written statement, the VUMC spokesperson said, quote, "Due to operational limitations and lack of surgical coverage, Vanderbilt Health will cease providing gender-affirming plastic surgeries for adults," end quote, adding that non-surgical gender-affirming care will continue for patients 19 and older. Gender-affirming surgery remains legal for adults in Tennessee. However, a bill restricting TennCare coverage has been advanced in the House. Okay, we've had some of these conversations, and I know that there's a lot of discussions about the surgeries, and I have to say, if the doctor is not on staff qualified to do surgeries, why would you go there? Mm-hmm. I mean, they are providing gender-affirming care. Yeah. It's the surgeries, and those tend to be issues. We've seen it already in Florida. We've seen it in other states that we've done that. I mean, some of the places here in Florida that used to do surgeries no longer do them. We see that that's happening across the country, and these physicians they're being feared of being prosecuted.
Of course, they don't want to lose their licenses or their livelihood.
Right. So it's like, to me, it's like a care. Yes, they're all still continuing to do that. But the surgeries, it's going to be more and more challenging, I think, for people to go through transgender surgery.
And people confuse both of those so much in our community and in storytelling and in news reporting, right? Understand that no one's getting a sex change at 12, okay? This is not what's happening. This is what these people want you to think is happening, but it's not, okay? By the book is 19 years old. It's a lot of therapy. There's a lot of counseling. There's a lot of things that come along with that. But, according to the Trevor Project and many folks that are way smarter than me, gender-affirming care saves children, okay? It literally saves their lives. It makes them not want to kill themselves, and that right there makes it more important than anything, But Vanderbilt stopping these adult gender-affirming surgeries, it's heartbreaking for those folks that have already gone through this cycle and they're awaiting to get this, this surgery done. But it's not shocking in the world that we're in 2026, Legal, but operational limits basically sounds political from my seat, from all our seats, and this is what these folks are having to deal with.
And I think it's interesting, they've been attaching the word plastic before the surgeries more than before. So people are like thinking, oh, it's plastic surgery, it's elective. But when you're trans, it's not something that you would
great point
elect to do. It's something you have to do. It's life-saving. It's necessary. It's not like, oh, I'm just gonna get my boobs done or whatever, just to look better. It's
called gender-affirming. It is affirming who you are.
Yeah. Exactly.
The most there's so much disturbing in this story. The most disturbing line for me. And I don't know the story behind this particular bill. I'm just taking it for what it was in your story. The government gave out patient info. What?
HIPAA what?
The university turned over patient information to the government. That scares the hell out of me on multiple levels. As a journalist, as an American, as a human being.
As a patient.
That scares me. The Trump administration a few weeks ago, maybe a few months ago, was finding universities for not turning over lists of Jewish students so that they could protect Jewish students from anti-Semitism. We have been down this road before. This is scary as hell. That is the part of the story that just worries me to no end.
You're absolutely right. Well, folks, there is no other queer nonprofit media platform like this in the entire world. Support our LGBTQ stories by sharing them and subscribing to Queer News Tonight.